Hey everybody, it's Dr. Brace here. Happy Facial Plastics Friday. Today I'm going to get off the usual topics of cosmetic facial plastic surgery and talk about something else that keeps me quite busy here at Guelph Facial Plastics, and that's skin cancer. Skin cancer is the most common cancer in the human body, and of all the skin cancers, a basal cell carcinoma is the most common tumor. Everybody thinks of melanoma usually when you think of skin cancer, but thankfully that is one of the more rare tumors, making up less than 5% of all the skin cancers. Basal cell carcinomas make up around 80 to 85% of skin cancers, and so they're far more common. And it's a good thing because basal cell carcinomas are not as aggressive as a melanoma, but they're still a cancer, they're still locally invasive, they can still cause a lot of damage, and in rare cases they can spread. And so part of my practice, a big part of my practice, is seeing people with skin cancers on their head and neck, removing those skin cancers, and then repairing the defect that the surgery causes. And so I was operating this week at the hospital from 8 a.m. to 6 p.m. All day, doing pretty much nothing but skin cancer. And I wanted to show some examples of what a skin cancer looks like, what the defect looks like, and how we repair them. So the first example here is a patient that had a basal cell carcinoma of their nose, so the upper inner aspect of their nose here. And I repaired this using what we would call a rotation flap. It's a variation of a paramedian forehead flap, but it's not as long, and it has the same blood supply, the supratrochlear blood vessels, but I rotate the tissue in a single stage to fill in the hole. And I love this flap for this area because it does such a great job at reconstructing a really difficult spot to reconstruct, and it looks really good once everything is healed. So if you look at our Instagram feed, there's a picture of a patient of mine who had this same surgery, who's a few months out, and you can see how good that flap heals. Another big part of my practice in skin cancer surgery would be reconstructing the nasal tip. And so when someone gets a tumor on the tip of their nose and you remove it with margins, you end up with a big hole that needs a big surgery to make it look right. You could theoretically just let it heal in or put a skin graft on it, but it will look horrendous and be disfiguring. And so what I will use in most cases is something called a pedicled flap, and specifically a paramedian forehead flap or a nasolabial fold flap. And a paramedian forehead flap is an ancient surgery. It has been described thousands of years ago, and it uses the blood supply that runs up the forehead into the head to keep the strip of skin alive, that if you cut it out of the forehead and flip it down onto the nose, you can reconstruct the tip with skin that has really good color match, really good thickness match, and can give a really great cosmetic result. So here's an example of one of my patients that had a tumor on the tip of their nose that I removed in the operating room and got clear margins, and then I used a paramedian forehead flap to fill in the hole. Now, this flap is kind of funny because you end up with a bit of an elephant trunk type thing for about a month. So the reason for this is that the blood supply to that skin is coming from the inner aspect of the eyebrow, kind of deep in the eye socket, and we have to keep it attached like an umbilical cord for about 3 to 4 weeks until the skin grows a new blood supply at the site where you put it, so in the tip of the nose. After 3 to 4 weeks, you can divide the pedicle and inset the flap very safely, and the skin will survive. And so this is always planned as a 2-stage surgery. But you can see the example of how good it looks when everything is reconstructed. A similar example on a smaller scale would be a nasolabial fold flap, and I use this usually to reconstruct nostrils. And so those are some examples of the bigger skin cancer reconstructions that I do. I wanted to show this today to let everybody know about the other side of my practice. It's not just cosmetic surgery here at Guelph Facial Plastics, it's also reconstructive surgery. I also do cancer surgery of the head and neck that's not just skin, but the thyroid and the salivary glands as well. And it's about two to three of those cases a month. A whole lot of skin cancer, usually on the order of 30-ish cases or more a month, and then all the cosmetic things we do. So remember to wear your sunscreen. Everybody have a great weekend. And if you have a spot on your face or neck that is not healing and it's been there for 2 or 3 weeks, you should have it looked at by your family doctor and biopsied to make sure that you don't have a skin cancer. Have a great weekend, everyone. Bye-bye.